And without further ado, I want to introduce to you Dr. Haleh Sheikholeslami. She will tell us about how to improve our immune system so we won't get sick. Dr. Haleh Sheikholeslami is an MD with a specialty in family and integrative medicine, and she's been practicing in Bay Area for over 24 years. Without further ado, Dr. Sheikholeslami.
Assalamu alaikum, everyone.
Alaikum assalam.
I'm going to share my screen and so that you can follow the slides with me. Everybody hopefully can see my slides, right? Okay. So this is COVID-19 and the immune system, how to keep your immune system strong during this pandemic. So we're talking about coronavirus. This is a group of viruses that cause respiratory illness in humans, from the common cold to SARS, MERS, and now the new virus, COVID-19. As a disclaimer, I'm not an immunologist, I'm not an infectious disease expert, and certainly not a coronavirus expert. I believe in integrative medicine, which is treating the body holistically and looking at everything that affects our health and how to prevent disease. After all, coronavirus is a virus and obviously more lethal and more infectious than some of the viruses we're used to, but a virus nevertheless, and we can use our experience of how to keep our immune system strong from other viruses. Just as a small piece of information, the coronavirus is called coronavirus because on the electron microscope, they have this kind of a corona or crown shaped form to them, and that's why they named it such. The foundations of a strong immune system is probably everything we all know, really. Sleep, mental health, and a healthy diet. But there's a lot of science to all the healthy lifestyle that we have been taught, right? So I think one of the most important aspects of keeping our immune system strong is sleep, is adequate sleep, which ensures the release of melatonin. Melatonin is a natural hormone. It's not just this pill that you take for jet lag, or you take it once in a while because you can't sleep. It's actually a natural hormone that's produced by the pineal gland. It is released when it is dark, and hence a lot of people who have a lot of light at night or electronics at night have a disruption of their sleep. And melatonin regulates the circadian rhythm, the natural wake and sleep cycle. But moreover, melatonin is a powerful antioxidant and has anti-inflammatory effects. There is this research showing that melatonin may decrease oxidative lung injury and inflammatory cell recruitment during viral infection. And what happens is with age, there's a decline in melatonin, and hence maybe the reason why viral infections may be worse as you get older. This is a study done at UCSF which showed how decreased sleep can increase your chance of getting a viral infection. I think my important thing is that this sleep is very much in this society kind of how should I say it? It's kind of like people think that it's good not to sleep as much. 8 hours of sleep is sometimes thought a waste of time. Hey, I can sleep 5 hours instead of 8 hours, and 3 hours I can do more work or have more fun or be on the whatever telephone, electronics. But sleep, as I'm mentioning here, is very important for the immune system. If there's something that is important to work on, is the sleep. And of course, good sleep is something that needs peace of mind. A lot of people have trouble with sleep, unfortunately. In my integrative medicine practice, insomnia is one of the top issues that people have. And that could be because of, you know, stress from work, or, you know, whatever, caffeine's, electronics, something is being disruptive. And I think it's important to address that rather than be with a lack of sleep, or even take strong medications for sleep, melatonin, and there's a lot of other natural supplements that can be helpful for this. The next important thing, I know Dr. Amiri will talk about this, is the mental health. But you know, we can't separate one from the other. Our immune system and mental health are very much correlated. Stress, worry, fear, anger, all can negatively affect the immune system. And stress in itself is can increase the inflammatory markers. And stress management techniques, which I'm sure Dr. Amir will go into, but you know, from prayer, meditation, deep breathing, guided imagery, all seem to decrease the inflammatory markers. And I think the silver lining in this pandemic is the importance of you know, self-care, and importance of taking care of our mental health first and foremost, because otherwise we are you know, kind of compromising our immune system. Diet, obviously, those who know me know how important I stress diet, but it is important to have a diet that is nutritious. Processed foods, canned foods, fried, greasy foods, frozen meals can be avoid of nutrition. And diet that is high in sugar and simple carbs and greasy fried foods are all inflammatory to the body. So there is no better time to improve your diet than now to improve your immune system. Many of the fruits and vegetables include, but also tea and cacao or cocoa, all have what's called chemical ingredient flavonoids. Each fruit can have its own flavonoid, and that's what gives the fruits and vegetables the rainbow of colors. Some I mentioned here, quercetin, curcumin, EGCG in green tea, and others, all have their benefits for the immune system. And then, and I'm sure everyone has heard to, you know, to eat enough vegetables and fruits, but there is a lot of science of why it helps your immune system be strong. To specifically talk about certain specific vitamins and minerals that are important for the immune system, one is vitamin C. Vitamin C is something that humans cannot synthesize on their own. So all of the vitamin C that we have come from diet, and it is not stored long, and it is used rapidly in the body. And there is an increased need during mental and physical stress for vitamin C, hence it is used up more. It is an important antioxidant. There are studies that doesn't show that vitamin C prevents cold, but it can shorten duration and symptoms of cold virus. And it's best to be taken, because it is used up rapidly and can't be stored as a supplement, it's best to be taken several times a day instead of one large dose a day, because our body cannot use all of that at one time. The IV vitamin C, controversial, but I'll go into it later in a different slide. Vitamin D, sorry to use the pandemic, but there is a pandemic of deficiency of vitamin D. And it is not just for the bones. It has anti-inflammatory effects and immune regulatory properties. It protects against respiratory illness in general. And it's important to keep the level as an optimal level. Sometimes even many doctors, you know, the level says should be like 20 to 80 and you're 22 and they say, oh, you're fine, you're within normal range. But within normal range is not what we want. We want an optimal range, which is around 50 or so. And then there was an article I was reading that during an active infection, because it may rev up the immune system during an active infection, that it may need to be stopped. But these vitamins should be built up in the system. They're not, unfortunately, they're not fast acting. They're not like many of the prescription medications. These are things that you need to have optimal levels long term. In fact, they've done studies in America. They've done studies of vitamin C, D, zinc, and there are many people with deficiencies of these vitamins. Zinc is is an important mineral. It has inhibitory activity against viruses. One article I was reading, it may decrease coronavirus virulence. 15 to 30 milligrams per day is a good dosage. And we've all heard about the underlying medical conditions with Dr. Moayer may go into that can keep increased risk of not only getting the virus, but increasing the risk of getting sick. And I just wanted to point out that smoking and vaping is in there. And there's a lot of talk about the homeless population as obviously being on the list, high risk. And there's even a whole page from the CDC about the homeless population. This is not only a risk to the community, but a risk for these people as well who are living unsheltered. The IV vitamin C, this is a JAMA article from October 2019 talking about use of IV vitamin C in a hospital setting when there's sepsis and the ARDS, which can happen with corona. It didn't say that there was less organ damage short-term or changes in marker short-term, but if you look at the end of the article, it did say that there was shorter stay in the ICU and on the respirator, which I think is an important. Here's another. This was
Just
yes.
Please explain ARDS for those who don't know medical terminology. Thanks.
Acute respiratory distress syndrome, which is in short, is what happens when your lungs are failing. This is a New York Post that talks about a pulmonologist in New York, Dr. Weber, who's using IV vitamin C in the hospital setting. Again, obviously there would be nice to have more long-term data about this, but without a lot of or any known risk side effects, I think this is important for many patients who are in a critical care to at least try. So what does this small virus that has caused so much problem teach us? I think it teaches us about self-care and care for others. Self-care is what I was discussing with how to optimize your immune system so that you're not the one getting the virus. But also it has brought everyone closer together, whether it's your neighbor, your immediate community, the country, or an international level. And it gives us a chance to help each other, right? Whether it's doing something small for your neighbor or for your community, or volunteering or giving your time in a broader, in a more broader sense. So this is not the time to be defiant of the laws to protect the spread of the virus. This is not the time. The good thing was that I was at the end of the talk, really. So I'm just going to open up to questions at this point.
Okay. So if you have questions, you could raise your hand, and we'll see your hand, and we'll turn on your microphone. Those who have questions? speak, you could type your question in the chat box as well, and you could see your question. Okay. What dose of vitamin C do you recommend, Dr. Sheikholeslami?
I guess sometimes when I'm recommending vitamins, it also depends on underlying diet, if they have a good diet, whether they're deficient. In general, 1,000 milligrams twice a day is a good minimum for adults to take, maybe half of that for children. But during such, lot of exposure or over this pandemic, you may want to take more. I'm taking 1,000 twice a day when I go out, whether I'm going to the clinic or whatnot. Maybe I come back and take an additional dose as well.
Okay, and Khanum Faride Shakirzadian asked about melatonin, but can taking melatonin supplement, but the question is not complete. So what about vitamin D? What doses of vitamin D?
I see the melatonin supplement. Can taking melatonin supplement help? I guess it's with the virus. Yes, so there has been an article that melatonin can be helpful for the immune system, and you can take it, especially if you're having trouble with sleep. You can take melatonin. The dosage varies. It can be a physiological dose of 0.3 milligrams. But range can be from 1 to 2 to up all the way to 9 milligrams. I will start slow and maybe go up if needed. The second question, does the corona patient? The coronavirus patient who survived carry corona and contagious to others. I will say what I have read, and maybe Dr. Moayer can also pitch in, but I have heard that some people who have symptoms have resolved from coronavirus may still be shedding the virus. How long? It's hard to say. Some people for weeks longer. So there's, I think, still ongoing on how long some people shed the virus. So that is a possibility. And as much as you can, staying away from others besides immediate family members is important. I mean, the social distance is important for everybody, obviously more so for someone who's had the virus.
Okay, and you answered the vitamin D dose?
Vitamin D dose, vitamin D is a fat-soluble vitamin. So unlike vitamin C, which you can take as much as you want and not much will happen, vitamin D, I usually go by the patient's level. As a generic answer, 1,000 to 2,000 IUs per day, international units per day is safe. Anything above that, I would be guided by what your levels are and see if you need more than that.
And finally, what is the incubation period for the virus? Why 2 weeks of shelter in? I assume 2 weeks of shelter, they mean when you have signs and symptoms, but you haven't tested to see if you're positive or not, or you're tested and you're waiting for your test results.
Yeah, so some people can have exposure and not have symptoms for a while. That's for sure. The 2 weeks is just a generic, time frame. I think for someone who has had the virus, obviously staying away from others as much as possible. If you have to stay from your own family, like some people who have to go to basements or one part of the house, a minimum 2 weeks. Does the fruit sugar decrease the immune system? Fruit sugar, well, there's a lot of, when I talk about sugars, I'm talking about added sugar or simple sugars. Fruit in general is healthy, although there are some people who eat a lot of fruits or eat a lot of high sugar fruits. I don't think, I'm not talking about sugar in fruits, especially if you're not diabetic or etc. I don't think that will negatively affect your immune system.
And finally, would men be more affected than women? I think that should be the final question.
Yeah, I have read that. I don't know if that is indeed true or not. Is it men more vulnerable, or are they more vulnerable to getting more sick than women? I'm not sure. I have read that though. I'm not sure if the other doctors can have an opinion on that.
So thank you, Dr. Sheikholeslami,
Thank you,
for putting your time and answering all the questions, and thank you for a good presentation as well. And this program is being recorded, so I don't know if we, we broke in the middle and then come back. So how that recording is going, but we'll work on it and post it on YouTube channel. And
okay, thank you. Be safe, everyone.
So next speaker is going to be Dr. Mehran Farid-Moayer. Dr. Mehran Farid-Moayer is a pulmonologist with subspecialty or specialty in intensive care medicine as well. And really, when people get really ill from COVID-19 and then they end up in ICU, they see doctors like Dr. Farid-Moayer. It's very nice of him to come and join us for this presentation, and he will talk about clinical manifestation of COVID-19. Dr. Farid-Moayer.
Hi, thanks for having me here. We can speak either Farsi or English, whatever people prefer. Basically, let me share my screen because I have some slides to share. And let me see, where is the presentation here? Slide. Which one is which one presents in Google Docs? Let's see. Anyways, I can just show it like that. Maybe one of these is a presentation. So basically, what happens is majority of the studies came from China because they had a large population initially, and they're pretty active. They started publishing a lot of papers that were published in the New England Journal of Medicine and other journals, and they reported in their population that the age range was around 15 to 89, but most of the patients were around, or I shouldn't say most, but the average was 59 years of age. At the ICUs locally in the Bay Area, especially our own hospital, majority of the patients are between 50 and 59, almost 80% of them. We've had in the, hospital has asked me, or has asked all the doctors, don't share much information about the hospital. But I should say, probably in general, maybe a few of them are around 70, 80 years of age, and maybe one or two people are in 40s. But mainly the ones that we see is 50 to 59.
Far right on the top is present. So next to the yellow box photo,
it's
right there.
behind this thing. Okay, great, thank you. Okay, what's happening here? And then, as far as the transmission of the virus, there was a paper that was published in the New England Journal of Medicine last week on the 26th of March, and Dr. Anthony Fauci wrote an editorial on it. And that paper, again from China, did a bunch of calculations and statistics, and they concluded that in a Chinese group, each individual transmitted the virus to 2 other people. Actually, it was 2.2 other people. And based on that, the doubling time was calculated to be 7 days for the number of people to double. And what happens is Dr. Fauci wrote an editorial, and he said if we succeed to reduce this transmission rate of 1 to 2 people to less than 1 to 1 person, then the virus transmission stops. And that's why social distancing is so important, Also, masks are very important because they reduce the transmission from a sick person to a healthy person, and hand washing, things like that. And then the other thing that I wanted to share is the virus shedding, means for how many days the virus is in the nose, and when we cough, it is produced to the air. And the shedding on average, again, was 20 days, and the range was 8 to 37 days. So practically up to maybe 40 days or so, the virus could be transmitted. But again, the problem is the data, because we are in the middle of a pandemic, the data is not very clear. These are preliminary reports. And then as far as the incubation time, it ranges. 97% of the time, the incubation time is between 2 days to 12 days. On average, it's around 5 days. From the time that we are exposed until we start having a cough and feeling ill is around 5 days or so. And then after that, after we feel ill, it takes another 9 to 15 days to get worse and to basically end up at the hospital. And then around 81% of the time is pretty, or let's say 80% of the time is pretty mild. It's a cold, we have a little cough, feeling ill, things like that. But around 20% of the time we end up at the hospital. And it's because of a pneumonia. And 14% of the time, it's just a pneumonia, like a plain pneumonia. The person goes to a regular floor with some medications and oxygen. 5% of the time, it becomes really, really bad. And then I'm going to explain or show you some images, things like that. And then 1 to 2% of the time, people die. Again, as you've seen in the statistics that are published every day, the death rate in different areas and different countries are different. And then people who die are people who have baseline conditions. Maybe they have heart disease, diabetes, high blood pressure is even listed in the group of the person who have higher mortality rate. Emphysema or asthma, cancer, people who have chronic kidney disease or on dialysis. Also, CDC has added a BMI of more than 40 or severe obesity in this group. Those people have higher chance of death, and that's the reason to start working on weight loss intensively right now. And as far as what happens, so what happens is basically the presentation is a pneumonia. And these black areas of the lung are normal areas of the lung, and then this whitish area is the pneumonia part, basically. And then in the middle, we see the heart. That's the aorta. Oops. Sorry. That's the arch of the aorta. And then this is the heart itself in the middle. And then the two sides should be black like this. And this is the CT scan of the person with the COVID pneumonia. These black areas, again, these are the black areas are air and normal, and then these are the vessels in the middle of the chest. This huge thing is the heart, and then this area is the pneumonia part. It shouldn't be like this. It should be like the other side, and majority of this area has whitish stuff, and another depiction of that, more whitish stuff here, which are pneumonia. And then this is the ARDS, which is acute respiratory distress syndrome, and stands for syndrome حاد تنفسی. Basically, it's a diffuse pneumonia. The entire lung is involved, and it's whitish. It should be black all over. And once a person has ARDS, basically the lungs fail to exchange oxygen and carbon dioxide, and the person needs mechanical ventilation. This is the mechanical ventilation machine. And these are the tubes that connect to the, well, I covered the face of this person, but the tubes that go to the mouth and goes to the trachea, And then the machine's situation is it pushes high pressure of the air and oxygen. Under high pressure, it opens up the lungs and delivers the air. And so basically, that's what they do at the ICU. They do the mechanical ventilation, high pressure, and then obviously there are a bunch of parameters, how much air you can deliver, how much pressure you can deliver, how much oxygen, things like that. You set up on the machine and you hope that it works. If it fails to maintain the oxygen saturation, then there are special beds at the ICU, which are prone positioning beds. We transfer the patient, actually nurses do that job. They transfer the patient to a particular bed that covers the top of the bed too. And then they wrap up the patient. The head is out with a little tray here, and the legs are out on the other side. And the bed rotates. And it's a very effective treatment for ARDS, especially for the COVID ARDS, because when the person is sleeping on the back, the lower parts of the lung, they are kind of inflamed, and then the fluid is going that way, and also the heart itself is sitting on the posterior part of the lung and pushing the posterior part down. So one part of the lung doesn't get aeration. It's it's swollen, inflamed, and also the heart is on top of that. So if you flip this person, then the other part of the lung gets the benefit of ventilation. And for that reason, when you flip them here, it helps a lot and oxygen improves. You can do it 12 to 16 hours a day. And if this fails, then we paralyze the patient. That means we give them paralytic medications. And then once the muscles are paralyzed, then they don't consume oxygen anymore. The problem is paralysis has side effects and later complications, things like that. So because when you do a paralysis in the ICU, it's a prolonged paralysis for days. And then what happens is that right away improves the oxygenation again, because you remove one source of consumption. And then if that fails, if everything fails and you still can't oxygenate the person, that means you are doing all of these and the oxygen saturation is still below 90% or 88%. Then we put the person on a extracorporeal membrane oxygenator, which is basically an artificial lung. And these are huge tubes that are inserted into the main veins of the person. It pulls the blood out, it goes to the oxygenator, and it comes back to the person. And what you see is right away, you see the oxygen saturation goes back to normal. The problem is each hospital has like actually most hospitals don't have ECMO machines or ECMO teams. And also the ones who do have it, they don't have many. They have probably 1, 2, or 4 of these machines. And then let me see what else I have here. So the question is, what happens when people get at home? I'm sorry, let me go get some water because I have a cough here.
If you guys notice, our first doctor had like allergy or cold symptoms, and our second doctor is coughing, but hopefully both of them are healthy.
Okay, very good. Sorry about that. So what happens is the question is, what should we do at home when we get ill? The main symptoms of the illness, you've read it, basically, you've heard it on the news and things like that, are coughing, sore throat, body aches. It's like influenza, basically. And also maybe loss of smell. And fever is the big symptom. And if you start having flu-like symptoms, you got to call your doctor. That's the first thing that you do. And then also you have to self-isolate, because immediately you want to make sure that you don't give it to other people in the household or the community. And then, sorry, you put a mask on your face, and then you disinfect the area, things like that. You stay in one room. And if you have an oximeter at home, you gotta use it to see what's your oxygen saturation. I'm not sure if people have oximeter at home, but I'm gonna show you these oximeters that are probably finger oximeter. These are the oximeters that you can buy on Amazon or elsewhere. They used to be around $10, $20, and it seems that the prices have gone up. And you check your oxygen saturation. And if it is below, normally our oxygen saturation is, in a healthy, normal person, it's always above 96%. Most of the time is around 98, 99% or so. If the oxygen saturation of a healthy person is below 95, it's abnormal. And then during the daytime while we are awake. And if the oxygen saturation is below 90%, that's severely abnormal, and you got to go to the hospital. And also, if you feel very short of breath and very ill, unrelated to oxygen saturation, you got to go to the hospital as well. And then what happens at the hospital? There are other things, by the way, that other indications to go to the hospital. One is if the person feels drowsy or sleepy or is confused, that's one of the signs of severe illness. And then if the heart rate increases, especially if it is greater than 120, or the pulse rate, if the respiratory rate increases, or the blood pressure is low, these are the other indications to go to the hospital. At the emergency room doctor does the same thing. They measure these things, and also they run some blood work. For instance, they check the acid-base status, and they do a blood gas, and also the other measurements. And if they are abnormal, or if you have some of these findings, they'll admit you to the hospital. And then as far as the hospitalization, most of the time when people go to a regular floor, which is the COVID floor these days, or COVID wing of the hospital, they get supplemental oxygen to make sure that oxygen saturation is above 90%. They get fluids, food, things like that. And also they start on plaquenil. I'm going to talk about medications. There are no proven medication, but we try them anyways. And then if the person becomes ill, they end up at the hospital. That means if the oxygenation is not maintained by just regular oxygen cannula, things like that. And also if the person becomes too sleepy, means becomes comatose, or goes through respiratory distress, that means it's very difficult to breathe. And then as far as the medications, one of the antivirals that is used under a clinical trial, and most hospitals have it, is remdesivir. And all we need to do is we put an order, and then we call the pharmacy. The pharmacy enrolls the patient based on their own inclusion-exclusion criteria. They enroll the patient to the clinical trial and start the medication. And then if it is not available, or if the pharmacy declines it, then the next medication is hydroxychloroquine, which is used for lupus disorder or lupus disease, and also is used for chloroquine, which is a similar medication used for malaria. And what they do is they change the pH of inside the cell. They increase the pH. And then once the pH inside the cell increases, the virus cannot enter the cell. And that's the basis for using that medication. But there is no information whether it works or not. And also it has cardiac side effects. Sometimes it causes cardiac arrest. It's rare though. And then Oh, this slide is incomplete. Sometimes also Chinese, they got the blood of the people who were recovered, and they removed the plasma and they injected the plasma of those people who were recovered to people who were ill, and they reported benefit. But again, these are not clinical trials or double-blind clinical trials. We don't know how it works, but FDA has approved usage in the United States under clinical trials. And so in New York, they are administering that. And basically, that is the presentation. We see how to stop sharing. And if you have any questions, please go ahead and ask.
Two questions already on the chat box. One was about obesity. The person says, I've seen a lot of people on television, they're obese. I think you addressed that issue, that obesity is a risk factor.
That is correct. Well, specifically CDC has said BMI of greater than 40 is a risk factor for death in COVID patients.
And the other question also was, is there a solution with antiviral properties to protect healthy people from being infected by SARS? So what they probably mean, is there anything people could take prophylactically to prevent them from becoming sick?
No, not at this point. The best source of information, well, in the United States is CDC, and internationally is WHO. If you go to WHO, they have a COVID website, and same thing with CDC, and they tell you what to do. As of today, there is no prophylactic medication. And all of these medications that are used at the hospital, by the way, all hospitals, we get like 10 emails from each of these hospitals during the day, and they update their recommendations, this and that. They have their own local policies. The policies, they go from CDC to the local public health and then to the hospitals. And what happens is they recommend a group of medications to be used in these patients, like plaquenil and antivirals, and none of them have any proof. We don't know if they are beneficial or not, but because we have no other treatment, we just use them, and the hospitals have added to their policies to use them.
Somebody asked, hi, can I use the CPAP machine as a ventilator?
Yes, well, there are three answers to that question. One answer is, the main thing is it efficacious? And also, is it safe? And as far as the efficacy, it does help with mild hypoxemia, because what happens is with the ARDS, the lungs get inflamed and so much fluid and inflammation happens inside the lung, including neutrophils and proteins, and they pour in the lungs. So these alveoli they collapse, or they are filled with protein and fluids and things like that. So you can administer pressure to open them, and the pressure has to be pretty high. That means CPAP of 15 to 20 centimeters of water to be able to open those alveoli. And that's what we do, by the way, at the ICU. When we intubate them, we put them on very, very high PEEP. CPAP in the ICU is called PEEP, which is positive and expiratory pressure. Anyways, we put them at 15 to 20 to begin with. So the point is, it is possible to administer the CPAP to open it, but the problem is safety. One issue with the safety is these people, they deteriorate sometimes so fast that if you have lost already time to take this patient to the hospital, then once they deteriorate, you don't have any time to take the patient to the hospital. So, and the way that it works is the person may have a little low oxygen saturation of 90% or so, or 92%, and feeling short of breath, fever. If you take this patient to the hospital, there is enough time to evaluate them, to put them in ICU, to intubate them. they may progress over the next 6 hours or so. But if that window of 6-hour progression time, if you use it at home and you put them on the CPAP and this and that, and then all of a sudden you may find that it works, but what if they deteriorate and all of a sudden you see the oxygen saturation is dropping and CPAP is not helping, and by the time that you mobilize yourself and call 911 and this and that, it may become too late. That's one issue, which is a major issue. And then the second issue is there are some information, it's controversial though. Some organizations, they recommend not using CPAP or BiPAP in the COVID patients because when it pushes air into the trachea or the mouth and you exhale, the air leaks around the little holes around the CPAP mask, which are intentional because you have to kind of exhale and wash out the carbon dioxide. That air that is pushed out from those holes has a lot of virus in it. So a person who is using a CPAP, that room is filled with the virus. If other people are in that house, they may easily catch it. So the point is, if a person is using, a COVID patient is using a CPAP at home, they have to absolutely stay in a different room completely, or they have to stay in a house by themselves and no one else is in that house. So safety is a big problem with the CPAP, but as far as efficacy, it is efficacious for mild problems.
One more question about hospitals. By the time they take the patients in, it's too late. They have to be very ill for them to take it. And they suggest that, do you think that's the reason it's too late by the time they're being admitted? So that's why they're not surviving, because it's too late by the time you get to see them.
Well, maybe there are criteria. You mean as far as getting them from the emergency room to the hospital floor, or from the emergency room to the ICU?
They're saying hospitals don't admit people that are not extremely ill. They have to be really ill before they admit them. It's their observation, or they've read it somewhere, I assume.
Well, what happens is there are several answers to this question. One answer is there are certain criteria that are made for hospitalization of patients with pneumonia. There are a bunch of scoring systems. And then basically when the person goes to the emergency room, they check the blood pressure, they check the respiratory rate, oxygen saturation, blood work, this and that. And then if some of these are positive and the patient has a high score, then they admit the patient to the floor or the ICU. And these are for any pneumonia, either viral or bacterial pneumonia. These are established criteria. But what happens is COVID-19 obviously may deviate from these established rules. And therefore, all physicians in hospitals that are not under surge stress, they are using the same pneumonia criteria. So basically, that's one answer, that the rules are kind of established and there are certain criteria that everybody follows. May not be applicable to COVID, maybe, we don't know. And however, there are certain surge factors that are involved, and then the hospitals, they're managing their own hospital, and the public health are managing the area and things like that. What's happening is if there's a surge of patients, then obviously they change the rules. And if a person normally, like in a normal situation, if a person comes to the hospital with an oxygen saturation of below 90%, we don't send them home. We admit the person with pneumonia or anything else. But in the COVID situation, when a hospital is under stress, like in New York, they don't keep them, they send them home. They send them home on oxygen, basically. And then they say, if you get worse, come back, because there is no space at a hospital. So there's some search planning that each hospital is following, then they decide what to do with their community.
And one person suggested that ivermectin is an anti-parasitic disease. In vitro shows that it inhibits SARS-CoV-2 growth in vitro, but it's far from being a drug. And the other person asked about the average age of patients being, said, the average age of 50 to 59 means the people in their 50s are more endangered comparing to older people?
No, that's a good question. I can't give you an accurate or good answer because we don't have published data, comprehensive published data in the United States. The data, one set of data came from Seattle, from the nursing home that got infected, and those were older people. A lot of data came from China, and some data which came from Italy, people were older. So part of the things that we see in the ICU are probably representation of the community as well. When I see patients who are between age of 50 and 59, most of them at the hospital here, is because in California, we've been under shelter in place, and no elderly people, they haven't left their house for the last like 2 weeks or so. And therefore they didn't get infected. And younger people, they left their houses. So you can't make any conclusion based on how many people are ill in the ICU. Overall, the data from Italy and from China, they show that the risk of death is higher in older people.
Okay, I think there's one more question oh, younger children, are they not at risk?
Well, they have less risk because the data that was published from China showed, I forgot the numbers, I have to look it up again. If you go to the New England Journal of Medicine, Chinese published a paper on, by the way, New England Journal of Medicine has a COVID-19 page, and it has summarized all of these papers. There's a paper from China showed I think there were like 300 Chinese children who were infected, they got ill. A group of them were admitted to the hospital. All of them recovered and went home. None of them died, but then there are some reports of death in the United States, very few. And in general, children recover very well, and they don't develop these respiratory distress or respiratory failures that adults have.
Okay. I think we're out of time. Mr. Behbahani wants to chat. I think he wants to talk about this in vitro study of ivermectin. I explained to him it's an in vitro study, so it's an approved FDA drug for parasitic infection. So they have to file for clinical trial before any hospital or any doctor could administer that drug to patients. So I assume that's the question that Mr. Behbahani wants to talk, but he typed it in and I responded to him.
Did you want me to say any about? I don't know about that. What happens is neither CDC nor local hospitals have it in their guidelines to try or to prescribe, and I have no experience.
Yeah, I clicked on the link. There's a paper published, but it's an in vitro study.
Correct.
In the laboratory. No human has taken it for the virus, COVID, for SARS-CoV-2 virus.
If you want, I can tell you the hospitals basically the policy right now is to call the pharmacy, get permission for remdesivir, which is an antiviral medication. Pharmacy will decide based on the inclusion-exclusion criteria If the patient is eligible, they start it. If the patient is not eligible, then the recommendation is to start hydroxychloroquine, which is used for lupus and immune disorders. So that's the recommendation. Start it at 400 milligrams twice a day for the first day, and then 400 milligrams daily for another 4 days, which is total of 5 days. And then also start antibiotics for possible infectious causes of pneumonia, because it's a pneumonia and sometimes you don't know if it is, especially in the first day when the test result is not back, you don't know if it is bacterial or viral. And then basically that's the recommendation. Start these two medications. There are some other medications out there, but some of them have other contraindications that cannot be used. For instance, Zithromax or azithromycin is also listed to be tried. The problem is if you start Plaquenil, which is hydroxychloroquine, you cannot start Zithromax at the same time, because both of them, they target, they have the same side effect on the heart. Both of them, they prolong the QT interval and may cause cardiac arrest, basically. You can't give both.
Thank you so much.
Sure.
So basically, what Dr. Farid-Moayer is suggesting, do not self-medicate. It's not because you don't know the drug interactions. This is something that doctors know, so do not self-medicate. Supplement is a different thing. Dr. Sheikholeslami covered the supplements you could take, but do not fool around with regular drugs, because the consequences could be more severe than COVID-19 itself. And thank you. At this part, we will switch to Farsi. از این بخش برنامه به فارسی صحبت میکنیم. خانم دکتر شعله امیری، روانشناس، استاد دانشگاه اصفهان و همینطور روانشناس بالینی، در مورد ترس و اضطراب صحبت میکنن. امیدواریم که صحبتاشون مؤثر واقع بشه، و چون من میدونم خیلی از ماها به خاطر شرایط بحرانی در ترس و اضطراب هستیم و این ترس و اضطراب مسلماً کمک به ما نمیکنه برای سلامتی روح و روانمون. بفرمایید.
بسم الله الرحمن الرحیم. عرض سلام دارم خدمت همه دوستان عزیز که در این موقعیت در خدمتشون هستم. از اجازه بدید که من چک بکنم ببینم آیا فایل من قابل دریافت هست از طرف دوستان یا باید دوباره اضافه کنم فایلمو.
بله خانم دکتر، فایل رو میبینید.
شما فایل رو مشاهده میفرمایید؟
بله بله.
بسیار خوب. خیلی متشکرم از اینکه این وقت در اختیار من قرار داده شده که بتونم با دوستان عزیز در خصوص مسائل و مشکلاتی که ممکنه در این موقعیت به وجود بیاد صحبت بکنم. نکته‌ای که وجود داره در این شرایط این هست که در حقیقت این ذره کوچک یک سبک زندگی خاص و جدیدی رو در حقیقت به همه ما تحمیل کرده. واکنش هایی که ما از خودمون نشون میدیم در حقیقت وابسته هست به نوع شخصیتی که ما داشتیم. نگاه بسیار واقع بینانه این هست که ما تمام این پروتکل هایی که وجود دارن از طرف سازمان های جهانی اعلام شدن، WHO اعلام کرده یا از طریق وزارت بهداشت همه کشورها اعلام شده، ما باید اینها رو بالاخره اجرا بکنیم. نگاه خوشبینانه این هست که موقعیتی رو فراهم آورده که در کنار اعضای خانوادهمون باشیم و من فکر میکنم که خب این یه فرصت هست، به جای اینکه ما بالاخره موقعیت‌های زیادی برای ما وجود نداشته که بتونیم مدت زیادی در کنار اعضای خانوادهمون باشیم، ولی این موقعیتی هست که در حقیقت برای ما ترس ایجاد کرده. ترس یک هیجان هست که در یه پاسخ هست، یه پاسخ هیجانی ماست در مقابل یه موقعیتی که این موقعیت تهدید کننده هست و ما میترسیم به خاطر که یه موقعیت واقعی وجود داره، یه تهدید واقعی وجود داره و اون ویروسیه که بیماری تولید میکنه و این ترس کاملا بجا، منطقی و در حقیقت بهنجاره. ولی ترس اگر تبدیل بشه به ترس مرضی ناکارآمدی ایجاد میکنه و ما نمیتونیم زندگی روزمره‌مون رو پشت سر بذاریم و اگر شدت اون از ترس مرضی به طرف یک وحشت زدگی پیش بره، در حقیقت ما نیازمند مداخلات روانشناختی شاید مجبور بشیم که مداخلات روانشناختی رو دریافت کنیم. و اما غیر از ترس ما با اضطراب مواجه هستیم. حالا تفاوتی که بین ترس و اضطراب وجود داره اینه که در حقیقت ترس یک موقعیت واقعی تهدید کننده هست، ولی برای اضطراب یک ابهام هست، یعنی یه موقعیتی هست که ما قابل پیش بینی برای ما نیست که در حقیقت چه اتفاقی میفته. به همین خاطر این در حقیقت ابهامی که وجود داره و غیر قابل پیش بینی بودن موقعیت ترس رو از اضطراب متمایز میکنه. و اما استرس به اصطلاح نام دیگه‌ایه که شاید گاهی وقتا ما اضطراب و استرس رو با هم به کار میبریم و شاید بعضی وقتا معنیش رو یکسان میدونیم، ولی استرس واکنش طبیعی بدن ما هست در مقابل موقعیتی که پیش اومده و نیاز هست که ما سازگار بشیم با اون موقعیت. استرس 3 مرحله داره. مرحله اولش اخطاره، وقتی که ما در مقابل موقعیتی قرار میگیریم که بدن ما باید پاسخ بده، ما با استفاده از مکانیزم جنگ و گریز که در حقیقت یه مکانیزمیه که در مغز تعبیه شده و به اصطلاح مدار خاص داره، اونجا بدن ما شروع میکنه به واکنش نشون دادن و آماده شدن برای این که بتونه با موقعیتی که به وجود اومده در حقیقت مقابله کنه. مرحله دوم مقاومت هست. اگر که موقعیتی که ما تحت تاثیرش قرار گرفتیم ادامه پیدا کنه، بدن ما در حقیقت باید این آمادگی لازم رو پیدا کنه که با موقعیت مواجه بشه. حالا اگر این موقعیت همچنان ادامه پیدا کنه، دیگه بدن امکان این که بتونه اون در حقیقت توانایی مدیریت رو داشته باشه از دست میده و در چنین مواقعی هست که بدن فرسوده میشه و سیستم روانی فرسوده میشه. این مواقعی هست که ما موقعیت‌های خیلی خطرناک باش مواجه هستیم، مثل حمله‌های قلبی، حمله‌های مغزی و یا شرایطی شبیه این موقعیت که عرض کردم خدمتتون. همینطور که عرض کردم در این شرایط ما ترس داریم بهنجاره، اضطراب داریم بهنجاره. نباید نگران باشیم در مورد ترسی که داریم. اتفاقا من فکر میکنم ترس اینجا بسیار حمایت کننده و حفاظت کننده است برای کسایی که مشکلات براشون به وجود اومده. شاید یک مشکل اساسی این بوده که اونها نمیترسیدن از این ویروس و در حقیقت اینجا جنبه تکاملی داره ترس و ترس به ما کمک میکنه که از خودمون مراقبت کنیم. بنابراین اگه ما داریم میترسیم نباید نگران ترسمون باشیم و این کاملا طبیعیه که ما ترس داشته باشیم. ولی تبدیل شدن به ترس مرضی، تبدیل شدن اضطرابمون به اختلال اضطرابی، اون هست که شاید در حقیقت مشکلاتی رو میتونه برای ما فراهم بیاره. برای اینکه در بعضی از افراد این زمینه اضطرابی فراهم هست و ممکنه که در حقیقت یه شرایط بهنجار به شرایط نابهنجار تبدیل بشه. اضطراب اینجا بهنجاره ولی اختلال اضطرابی دیگه بهنجار نیست. از تمام کسایی که احساس میکنن شخصیت اضطرابی دارن یا اینکه در مرز این شخصیت قرار گرفتن یا اینکه در حقیقت احساس میکنن اضطرابشون بیشتر از حد معمول فراتر از حد معمول رفته، تقاضا میکنم که تکنیک های حواس پرتی و تمرین های ریلکسیشن رو انجام بدن. یعنی در حقیقت ما استرس داریم، نباید بذاریم که به اصطلاح سیستم بدنمون به در حقیقت به فرسودگی برسه. برای اینکه من متمایز کنم بهنجاری و نابهنجاری رو، اجازه بدید که از یک در حقیقت از یک مثال استفاده بکنم. شما اگر که ببینید یه فردی داره، یه فرد سالمی وقتی دستش رو میشوره، بعد از اینکه این شستشوی دست به اتمام رسید، اگر از این فرد سوال کنیم که آیا دست تمیزه، میگه بله. حالا همین فرد رو در نظر، همین موقعیت رو در نظر بگیرید برای فرد وسواسی. اگر از فرد وسواسی همین عمل دست شستن رو چندین بار تکرار میکنه و در حقیقت در پایان کار حتی اگر از شما از فرد بپرسید که آیا دست شما تمیزه، اطمینان نداره که دستش به اصطلاح به اون درجه از تمیز بودن رسیده. حالا ما با یه فرد دیگری مواجه هستیم که بهش میگیم شخصیت وسواسی. فردی که شخصیت وسواسی داره به چه صورته؟ اونم دستاشو میشوره. به چه صورت؟ با دقت کامل میشوره و همون 20 ثانیه شاید هم بیشتر. در فردی که شخصیت وسواسی داره شاید اگه بگن 20 ثانیه باید دست شستشوی کامل داده بشه، اون ممکنه 40 ثانیه انجام بده. ولی نکته‌ای که وجود داره، پس از اتمام کار اگر از ایشون بپرسیم که دست تمیز شده، با اطمینان کامل میگه که دست من تمیز شده. بنابراین شاید الان برای ما لازم باشه که یکم به صورت مثل افرادی که شخصیت وسواسی دارن عمل بکنیم، ولی باید حواسمون باشه که این تبدیل به اختلال نشه، تبدیل به وسواس نشه، تبدیل به اختلال وسواس نشه. حالا چه زمانی هشدار وجود داره و چه زمانی ما وارد یه مرحله جدیدی از استرس شدیم؟ اگر که به رفتار خودمون دقت بکنیم، به خواب، خوردن، نیازهای اولیه‌مون، به اصطلاح روابطمون، حرکاتمون، متوجه میشیم که خب حالا خانم دکتر شیخ الاسلامی اشاره فرمودن به خواب که و اینسامنیا که ممکنه اتفاق بیفته در این مورد، در این زمینه، و این که در حقیقت ممکنه روی منتال هلس ما تاثیر داشته باشه. من میخوام همینجا به اصطلاح اشاره بکنم که خواب کافی بسیار اهمیت داره، تغذیه کافی بسیار اهمیت داره، ولی اگر ما مشاهده کردیم که در حقیقت خوابمون بیشتر از حد معمول شده، بیشتر و یا خیلی کمتر از حد معمول شده، به خصوص کاهش خواب اینجا یکم نشانه است. اگر خوردنمون زیادتر از حد معمول شده یا کمتر از حد معمول شده، نشانه است. اگر روابطمون با دیگران به گونه‌ای شده که دائم مضطربیم و میخوایم که به افراد نزدیکانمون زنگ بزنیم، از حالشون خبردار بشیم، به حدی این اتفاق میفته که در حقیقت اونا مستاصل میشن و اونا رو نگران میکنیم. این یعنی رفتار ما از حد معمولش خارج شده. حرکاتی که داریم به صورت بیقراری ممکنه خودش رو نشون بده. افرادی که دائم از یه طرف منزل به طرف دیگه میرن، یا بیقراری روانی، افرادی که در حقیقت شرایط رو برای دیگران در حقیقت تنگ میکنن، اینها نشانه های در حقیقت استرس هست که داره اتفاق میفته. حالا ما برای اینکه راحت‌تر با این موضوع کنار بیایم، برای اینکه دلایلی که استرس وجود داره و اضطراب وجود داره، معلومه که این ویروسی هست که به همه مناطق راه پیدا کرده. برای اینکه راحت‌تر با موقعیت کنار بیایم، اول اینکه بهتره که یه منبع معتبر برای خودمون پیدا کنیم. منبع معتبر، حالا پیشنهاداتی که وجود داره همون به اصطلاح سایت WHO هست، یا اینکه در حقیقت وزارت بهداشت هر کشوری نتایجی که میده یا مطالبی که عنوان میکنه به نظر من خیلی قابل توجه خواهد بود و این ما رو آرام میکنه که در حقیقت چه کار انجام بدیم. یه نکته خیلی مهم اینه که از وارد شدن به سیستم شایعات خودداری بکنیم. تحقیقاتی که در زمینه روانشناسی اجتماعی وجود داره نشون میده که در حقیقت در مواقعی که ابهام وجود داره شایعه افزایش پیدا میکنه و این شایعات در برخی از افراد متاسفانه جانشین واقعیت میشن و این باعث میشه یک ترس اجتماعی گسترده ایجاد بشه. بنابراین من توصیه میکنم که اگه به فضای مجازی هم وارد هستیم و استفاده میکنیم که هممون هستیم، حواسمون باشه بعضی از خبرهایی که اونجا گذاشته میشه، نظارتی که بر روش نیست، اینها شایعه هستن و میتونه این شایعات سیستم روانی ما رو به خودش مشغول کنه و ما با اونها نشخوار فکری کنیم. متاسفانه در افرادی که اضطرابی هستن، یعنی اختلال اضطراب دارن، دائم با این شایعات میشینن، نشخوار فکری میکنن و نه فقط خودشون، اطرافیانشون رو هم دچار مشکل میکنن. نکته دیگه اینه که تحلیل خطر بکنیم، ببینیم آیا در اطراف ما کسی هست که به این ویروس آلوده شده یا ناقل این ویروس هست، چقدر ما با اون ارتباط داریم. اگر من داخل خونه نشستم یا رفت آمدم به بیرون زیاد نیست، معلومه که خطری منو تهدید نمیکنه اگه دارم رعایت سیستم بهداشتم رو میکنم. بنابراین نگرانی بیش از حد شاید بالاخره همون اضطراب زیادی هست که بعضی از افراد پیدا کردن و این هشدار برای خودشون. چه کار میتونیم انجام بدیم که در حقیقت اثر بخشی داشته باشه؟ یکم من فکر میکنم گاهی وقتا لازم هست اخبار رو پیگیری نکنیم، به خودمون استراحت بدیم، از حواس پرتی استفاده کنیم، به عمد حواس خودمون رو پرت کنیم. حالا چطوری؟ تکنیک هایی که وجود داره برای حواس پرتی اینه که فیلم نگاه کنیم. یه وسیله‌ای که توی خونه خراب بوده و مدت‌ها بوده ما می‌خواستیم درست کنیم، الان فرصتش هست، حواسمون رو به اون متمرکز کنیم. میتونیم به اصطلاح با دوستانی که میتونیم فعالیت‌های معنوی انجام بدیم و این خیلی آرامش زیادی برای ما ایجاد میکنه. تحقیقات در زمینه معنویت که انجام شده نشون میده که افراد معنوی خیلی در زمانی که استرس های بزرگی مثل این استرسی که الان باش مواجه هستیم در حقیقت روبرو میشن، چون اونها اون راضی‌اند به رضای خدا، یا به اصطلاح در فرهنگ‌های مختلف معنویتی که وجود داره، حالا معنویت ما دینی است، معنویت‌های غیر دینی هم وجود داره که افراد میتونن بر اساس اون عمل کنن، ولی اینا خیلی کمک کننده است. تحقیقات هم این رو نشون میده که افراد معنوی آرامش بیشتری دارن و سلامت روانی بهتری برخوردار هستن. تمرین‌های یوگا، مراقبه، ورزش، اینها خیلی کمک کننده هستن. گوش دادن به موسیقی، استفاده از کتاب‌های گویا یا همون اودیوبوک ها. من فکر میکنم که خیلی راحت ما میتونیم رمان بخونیم، تاریخ بخونیم، ادبیات بخونیم. اینها موقعیت خیلی خوبیه که برای کسایی که در خانه مجبور شدن که بشینن از این موقعیت استفاده کنن، یا به اصطلاح برای کسایی که فعالیت علمی داشتن میتونن مقاله هاشون رو بنویسن، میتونن پروژه های ناتمامشون رو انجام بدن. تلفن زدن به دوستانی که ما سالهاست ازشون خبر نداریم به خاطری که وقت نمی کردیم که با اینها در ارتباط قرار بگیریم بسیار میتونه کمک کننده باشه. دیدن مناظر و موزه های دنیا و مکانهای دیدنی دنیا که امکانش به صورت آنلاین فراهم شده، این هم به نظرم خیلی میتونه کمک کننده باشه و جذاب. و اما در مورد خانواده و مدیریت این موقعیتی که به وجود اومده، من سعی کردم خیلی خلاصه فقط به محض یادآوری و به محض اینکه با هم دیگه مرور کنیم چه مشکلاتی میتونه اتفاق بیفته، اینها رو اومدم طبقه بندی کردم برای زوجها، برای کودکان، برای نوجوانان و جوانان و سالمندان که در حقیقت به چه صورت میتونن ما در نظرشون بگیریم. زوجها، در مورد زوجها و شرکای زندگی ما، مسائل رضایت از زندگی، مسئله رضایت زناشویی، مسئله رضایت ارتباطی نکات مهمی هستند که در زندگی زوجها وجود دارن و ما الان فرصتی نیست که دقیق به اینها بخوایم بپردازیم. ولی نکته مهمی که در این زمان بیشتر خودشو نشون میده اختلاف نظری هست که در اجرای پروتکل‌های مرتبط با ویروس وجود داره. حالا ما چطور میتونیم به عنوان به اصطلاح اعضای خانواده و به خصوص زوجها چطور میتونن این مدیریت کنن مشکلات بین فردشون رو؟ به نظر من اول اینه که سعی بکنیم که اختلاف نظر رو بپذیریم که ما الان اختلاف نظر داریم و همیشه داشتیم شاید، ولی الان فرصت زیادتری داریم که این اختلاف نظراتمون رو ببینیم، چون چیزهای مشترکی وجود داره، سلامت وجود داره، سلامتی هست که مورد تهدید قرار گرفته و همه ما میخوایم کاری بکنیم که این سلامت حفظ بشه. بنابراین اعتماد کنیم به اون کسی که دانش بیشتری در این خصوص داره یا اینکه اخبار بهتری در این خصوص جمع‌آوری کرده و به نظرم میرسه که اختلاف نظر و داشتن تفاوت و اختلاف نظر اصلا زیبایی خلقته و توی این زمان از اینکه به اختلاف نظر ما به جر و بحث تبدیل بشه جلوگیری بکنیم. اون نکته مهمش هم اینه که زمانی که جر و بحث به وجود میاد یک نفر باید بحث و خاتمه بده یا کنار بیاد یا کنار بره از به اصطلاح قضیه بحثی که به وجود اومده. خودمون رو جای فرد مقابل بذاریم و این که در حقیقت به این پرسپکتیو تیکینگ داشتن، از دریچه دید دیگری به قضیه نگاه کردن بسیار کمک کننده است. همسر من هیچ وقت دشمن من نیست، هیچ وقت نمیخواد منو اذیت بکنه. اگر نکته‌ای داره میگه بابت نگرانیه که راجع به من داره، پس بنابراین من اگه خودم رو به جای اون بذارم مشکلی که به وجود اومده رو میتونیم حل بکنیم. توجه به انرژیایی که در ما ضبط شدن و هر لحظه دنبال بهانه‌ای میگردن که در حقیقت به شکلی خودشون رو نشون بدن و این به اصطلاح این انرژی ها از طریق زبان و از طریق رفتار ما جستجوگری میکنن برای که خودشون رو نشون بدن. بنابراین مواظب زبان خودمون باشیم. ممکنه در شرایط استرس ما صحبتی بکنیم، حرفی بزنیم که طرف مقابل خودمون رو به شکل اساسی دلخور کنیم. بپذیریم این شرایط خاصه که برای ما به وجود اومده و اختلافاتمون رو میتونیم حل کنیم و امیدوار هستیم که میتونیم حل بکنیم. روی نقطه ضعف‌های همدیگه به اصطلاح به نقطه ضعف‌های همدیگه نپردازیم. بریم سراغ نقطه‌های قوت همدیگه و به اصطلاح این موضوع بسیار بسیار اهمیت داره. در مورد کودکان و نکته بعدی که میخوام عرض بکنم خدمت دوستان عزیز در مورد رفتاری که ما با کودکان باید داشته باشیم یا در حقیقت اینکه در این شرایط با کودکان چه رفتاری بکنیم و چه کار کنیم. قبل از اینکه اشاره بکنم اول میخوام به کوپینگ اشاره کنم و اینکه روش‌های مقابله‌ای که در حقیقت والدین به کار میبرن کودکان از اون تقلید میکنن و در حقیقت تحقیقات متعددی در روانشناسی وجود داره که نشون میده که کوپینگی که بچه‌ها به کار میبرن دقیقاً برگرفته شده از همون کوپینگیه که والدین به کار میبرن. بنابراین این که ما بتونیم مدیریت کنیم موقعیتی که درش قرار گرفتیم بسیار اهمیت داره. اینکه کودکان جهان رو و موقعیت امنی بدونن یا ندونن به اتچمنت اونا ربط پیدا میکنه و این چیزی نیست که امروز به وجود اومده باشه. اتچمنت در 3 سال اول زندگی به وجود میاد و شکل میگیره و تموم شده، گذشته رفته و الان مداخلات عمیقی لازمه که اگر یک ناایمنی روانشناختی وجود داشته باشه ما بخوایم تبدیلش کنیم به ایمنی، بنابراین حواسمون باشه. بعضی از بچه‌ها دچار ناایمنی روانشناختی هستن. حواسمون باشه شنیدن اخبار زیاد راجع به مرگ و میر، راجع به اتفاقی که داره میفته میتونه اونها رو بیشتر نگران کنه و بهتر است که حواسمون به بچه‌هایی که در معرض خطر هستن باشه. بهتر از فاجعه سازی در مقابل کودکان خودداری بکنیم. بسیار اهمیت داره که ما وقتی وحشت میکنیم احتمالاً بچه‌هامون چند برابر ما وحشت میکنن. بنابراین موقعیتی که به وجود میاد یا مثلا آمار مرگ و میر که ما میشنویم، اگر دائم در مورد اون صحبت بکنیم بچه‌هامون دچار مشکل میشن. هر چی که ما میخوایم به کودکانمون بگیم قبلش در موردش فکر کنیم که چه میخوایم بگیم. یه موقعیت مناسب پیدا کنیم وقتی میخوایم در مورد ویروس صحبت بکنیم، در مورد پروتکل‌های به اصطلاح رفتن بیرون آمدن یا هر چیزی میخوایم صحبت بکنیم، بهتر هست که در حقیقت قبلا در موردش فکر بکنیم. یه موقع وقتی میخوایم صحبت بکنیم و تمرکز داشته باشیم، این که بچه مشغول تلویزیون نباشه، مشغول بازی نباشه، فیس تو فیس باشیم، کنار هم قرار بگیریم، این بسیار اهمیت داره. بررسی بکنیم که اون موضوعی که ما میخوایم در موردش صحبت بکنیم بچه‌های ما چقدر در مورد اون موضوع میدونن. اگر چیزایی هست که در موردش ازش اطلاع دارن که نیازی نیست که ما در موردش زیاد صحبت بکنیم، ولی اگر نیاز هست که ما قانعشون کنیم بر انجام یک کاری، بر صورت باید حتما این کار رو انجام بدیم. بنابراین والدین باید اول آرامش نسبی در خودشون ایجاد کنن، بعد برن سراغ کودکان. همونطوری که تو هواپیما دیدید که میگن اول ماسکو بذار روی صورت خودت، بعد ماسکو بذار روی صورت بچه‌ای که کنارت نشسته. این در حقیقت این که ما اول خودمون رو آرامش کنیم، بعداً بتونیم بچه‌هایی که داریم یا بالاخره کودکان رو آرامش بدیم، این بسیار اهمیت اساسی داره. بعضی وقتا لازمه که ما احساساتمون که ترسیدیم یا اضطراب، به خصوص حالا ترس به نظرم کمتر و اضطراب بیشتر یا استرس بیشتر، ما به بچه‌هامون بفهمونیم که ما هم استرس داریم یا ما هم اضطراب داریم. چرا؟ چون بچه همیشه پدر مادرش رو به یه گونه دیگری دیده و در حال حاضر یه دفعه متوجه میبینه که پدر مادرش به یه گونه دیگه دارن رفتار میکنن. این که ما بگیم ما این شرایط خاص شده و ما به این دلیل هست که در حقیقت اضطراب داریم، برای کودکان متناسب با سطح ذهنی اونها میتونیم توضیح بدیم که متوجه بشن. بعضی وقتا اگه مطلبی رو ما نمیدونیم بهتر هست.
خانم دکتر ببخشید، ما باید تا چند دقیقه دیگه این جلسه رو ختمش بدیم.
اگه بسیار خوب، من سعی کنم خیلی
ممنون.
سریع‌تر برم. در مورد نوجوانان باید به یه نکته بپردازیم و نوجوانان نمیخوان تو خونه بمونن. مشکلی که ما داریم اینه که باید از به اصطلاح بحث کردن باشون خودداری کنیم، باید بریم سراغ منطقشون. اصولا نوجوانانی که در خانواده‌های خوب تربیت شدن وقتی میرسن به نوجوانی از منطق برخوردار هستن. اونهایی که از منطق لازم برخوردار نشدن و متاسفانه رشد یافتگی کافی پیدا نکردن، کسانی از هیجانشون باید کمک بگیریم. باز هم ما دارک پرسونالیتی داریم، یعنی بچه‌هایی داریم که همچنان از این هم فراتر هستن، بازم میخوان کار خودشون رو انجام بدن، نمیخوان به حرف کسی گوش کنن و فکر میکنن هیچ خطری وجود نداره. برای اونها میتونیم از احساس گناه شده حتی باید استفاده کنیم، برای اینکه این قضیه میتونه دیگران رو هم درگیر کنه. نکته بعدی که میخوام در مورد سالمندان میخوام صحبت بکنم و اشاره بکنم، اون چیزی که در فرهنگ ما وجود داره، این کلمه پیر عبارت است از یک شیخوخیت و بزرگی و عقلانیت و در حقیقت بزرگمنشی. این قضیه بسیار مهمه که ما به پیرامون به این چشم نگاه میکنیم و در حقیقت میخوام عرض بکنم خدمت شما که دو گروه افراد داریم، یه گروهی که تنها زندگی میکنن یا این که تنها نیستن ولی احساس تنهایی دارن، یه گروهی داریم که اینها در خانواده زندگی میکنن. مسئولیت انتقال پیام بررسی پروتکل‌ها باید در اختیار کسی در خانواده قرار بگیره که بیشترین اعتماد و اطمینان نسبت بهش وجود داره و میتونه در حقیقت با احترام کامل با سالمندان به صحبت بپردازه. از سالمندان گاهی وقتا ما مجبوریم مثلا ظرفای غذامون رو علامت گذاری بکنیم، هر کسی ظرف خودش رو داشته باشه. در این شرایط ممکنه که سالمندان واکنش نشون بدن، احساس این که در حقیقت احساس مطلوبی ندارن، این که ما در حقیقت به اونها توضیح بدیم که چرا مجبوریم چنین کاری رو انجام بدیم بسیار بسیار اهمیت میتونه داشته باشه. و نکته آخری که میخوام اشاره بکنم این هست که در حقیقت ما وقتی با دیگران همدلی میکنیم، وقتی با دیگران به یک ایمپاتی در حقیقت میرسیم، خودمون از اون بیشتر از دیگران بهره میبریم. خیلی متشکرم.
خیلی ممنون خانم دکتر. استفاده کردیم چون یه جلسه دیگه هم ساعت 7 برگزار میشه و اون دوستان باید برن تو اون اتاق فرمان ببینن که آماده بشن. برای همین ما این برنامه رو ختم میکنیم.